Minister and members in the House, we all recognise that medical cards are of extreme importance. They are a very important source of support that are supposed to provide access for those who cannot otherwise afford the required medical care. We must always remember that this is the primary purpose of the medical card, to support the patient. Sometimes it seems that this focus on the patient gets lost, and that their needs gets lost in the political infighting and in the system. Everybody in this House is aware of the very difficult stories where people are just over the income level, or where people with certain medical conditions, because they're over the limit, can't get a medical card. These are heartbreaking stories, and they are stories that all of us in this House can share. In saying that, we as politicians have an obligation and a duty to reflect upon the system and how we can make it better on behalf of the patient. When people get letters in the door, Minister, saying that their medical card is being reviewed, it does cause distress, rightly or wrongly, even if it is only a simple review process. For some people, these letters translate to, they are trying to take my medical card away, or I've lost my medical card. Thankfully, as other members have said, in 93% of cases, this does not happen. But sometimes, I do believe, Minister, the system forgets the impact of the letters and the decisions thereafter can have on the impact on the person and their families. On tomorrow, Thursday, the Health Committee, which I chair, are travelling to Finglas to visit the PCRS section. We will speak with the staff and we will visit the processing centre in Finglas, and it is the personal impact on how the system affects the patients that I will be highlighting, I'm sure, many of my colleagues with the staff and management at the centre. And I do want to pay tribute, to the staff at PCRS for the work that they engage as civil servants and public servants. Yes, there are difficulties in the health system, but we must also recognise that over the past 3 years improvements have also been made, not alluded to in the reference in the motion before us tonight. These improvements are down to the reforming ministers, but also to the hard work and dedication of the staff in the health service of our country. At the peak of the boom and at the beginning of the bust, when you adjust for our very young population, Ireland has and had one of the most expensive health systems in the world. Since this government has come into power, we have managed to do what the party opposite failed to do. Oh, sorry, they're not here. That's Fianna Fáil, my apologies. It shows their dedication to the health system that they're not even here. It has increased services even as it had cut costs. Hospital budgets are down 11% since 2009, while the number of people treated is up almost 13%. This is the equivalent to a 24% productivity improvement. But it's not about productivity. It's about the quality of the staff of our services. The number of trolleys in 2013 are a third lower than in 2011, where trolleys reached chronically high numbers. This year, we have seen thus far a 9% reduction than last year. The government's and the minister's reform programme can and will do even more to make the system more efficient. But I have to say, Minister, that I, as a member of the Dáil and as a public representative, am becoming increasingly uncomfortable about the level of savings which are being demanded in the health area. There seems to be a view among some that the health sector is some kind of a public sector ATM machine, that if you just press the right buttons, it can continue to deliver cash savings. The bottom line is this, Minister, as you know quite well. We have an ageing population and demand is growing. We cannot keep asking the men and women who work in our health system, or the citizens, the people who depend on our services, that they deliver to keep taking a financial hit in the health area. I don't believe it's fair. I believe it's completely unrealistic. And I do hope, Minister, that in the wider health debate leading to UHI, that we will recognise that in the area of health, it is demand-led, it is about people. If we want to have a medical card system that does not operate on the basis of who you know, as it was in the past, but functions based on the need of the people and the needs of the citizen, we must change legislation, we must change our approach to health, which this government is doing in regard to UHI. We also must have regulations in place that allow officials to make appropriate decisions so that we can meet the health requirements of those most in need, in a way that is humane, that is full of empathy, and that recognises that there are people whose medical conditions deserve the medical card and the long-term illness. And I would conclude, Glasgow and Corla, to challenge the members opposite from the Sinn Féin party that they haven't put in their motion to name us your solution, to show us your way forward. Put the meat on your motion. Don't just play politics. Don't just play populism. Show us what your policy actually is. Reveal your hand. I respect Deputy O'Quillan as a valued member of the Health Committee, but I'm calling on him and his colleagues to put their motion with the substance of what their health policy is, because talk is cheap.
Thank you,
and you've done a lot of that in the last couple of weeks.
Deputy Peadar Tobin is sharing with